Good evening. Hello. Can you hear me? Hello.
Yeah, hello.
Good evening, ma'am.
Good evening, everyone. So, you must have heard that there will be a test today.
Yes, ma'am.
Yes,
Yeah.
ma'am.
Actually,
Yes.
it was not planned, but the thing is, yesterday we noticed that some of you guys have not, like, you did not get the time to complete the questions, which were provided as a homework. So, now it will be done in a class. So, it's nothing much. It's just you'll get 1 hour, 1 or 1.5 hours to complete your questions. Questions are given accordingly only. Like I've just given 22 questions, and we'll just see if you all complete it. Then we can discuss the answers, and if there are any doubts or any wrong questions, we'll just clarify it. Okay?
Yeah, ma'am.
But by the way, you have completed. You all have completed, right? The questions which were given in the like as homework.
Yes, ma'am.
Yeah, because without that, you'll face some difficulty. It's the same sort of questions, but like you'll get a little idea of the questions then. So let everybody come, then I'll give a PDF. Okay, you all can start at the same time.
Good evening, ma'am.
Hi, Bhavna. I think I've not met Rupa yet. Like, did we have an introduction for Rupa?
Yes, ma'am.
We did. Can you switch on
Yeah,
your camera? I actually forgot your face. I
I'll
remember
just.
everybody. Yeah. Okay. Okay. I remember now. Cool. 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 You can switch it off. So I would like you all to have a pen and paper today to do like note down the answers. And when the test is over, you can just tell me how many are correct, so that we can assess your performance based on this test. And if you have done the 50 questions which were given earlier, you will be able to crack it very easily. I know, Bhavna, that I was supposed to give it as a homework, but then I was told that some of the people have not done it. Like they also watched the video and they were like, no, no, you give a test on call and we'll assess it. So now that's what we are doing.
Okay, no issue, ma'am.
Okay.
Yes, ma'am.
So from tomorrow onwards, definitely we'll start our cardiac.
Okay, ma'am.
Okay. Or what do you want me to start? Like, where do you want me to start cardiac? Do you want to do after anatomy and hemodynamics, of course? What topic do you want me to cover? Shall we start with the child diagnosis or shall we start with the adult?
I think with adults is better, ma'am,
Okay, okay.
than
Sure,
kids.
sure, sure. Sure. Wait 5 more minutes. But stroke is clear. Do you have any questions on stroke? You can ask me now. Any question on any diagnosis, nervous system, if you have any doubt, you can ask me. No? Okay.
I think, ma'am, when we got a question on stroke, now then we know like how much we know about stroke actually.
Stroke, you will be able to do because my PowerPoint presentation was mainly based on the questions which are which will come. It was very straightforward, and
Yes,
the
ma'am.
symptoms and everything was
Yes,
described in
yes.
the PowerPoint. So if you have seen the PowerPoint and if you have revised it, you will be able to crack it. Okay, so no
Yes,
worries in that. Just remember, if there is stroke, there will be high ICP, there will be scissor precautions, there will be skin integrity, and these all things will matter the most. Okay, rest so you all know.
Ma'am, I have no doubt. Apart from my our subject, apart from
Pardon?
neurosystem, apart from neurosystem,
Yeah.
I have question. One patient yesterday evening, he is history of type 1 diabetes. He is
Okay.
taking insulin 12 units.
Is it a question? Is it a question you are reading from somewhere? You can just provide me a picture on the screen in the chat.
I don't have any pictures.
Okay. Because your voice is a little unclear. Yeah, just tell me again. The patient is having diabetes mellitus and
Type 1 diabetes.
Type 1 diabetes.
Type 1 diabetes. Past 17 years, he's taking insulin.
Yes.
Yesterday, what happened? He felt giddiness, and he felt like shock, like jerky movement he's having.
So he must be hypoglycemic. He must be hypoglycemic, right?
Yes, hypoglycemic only. I have checked the blood glucose level. It was 42 only.
Okay. And he was 17 years of age.
No. Last 17 years, he had diabetes mellitus. His age was 33.
Okay, blood sugar was 42. He's having diabetes mellitus 1 since last 17 years, and he was feeling dizzy and he was having jitteriness, right?
Yes, jerkiness. Whether it is seizure or what, I don't know.
It's not scissors. It's not scissors.
It's attack.
It's not scissors. If that's your question.
Hypoglycemia attack.
Yeah, it's hypoglycemia. But what happens in hypoglycemia? Our calcium level also drops down. Okay, so you have a sudden jerkiness in your hands, but that's not seizures. Seizures has a definite symptom.
Not only hand, ma'am. The jerky moment. Whole body, he is having like jerky moment, like seizure patient acting, no? Like kind of things he is having. So I suddenly saw the patient. Patient got seizure. Okay. We made to position, lie down and recovery position to the patient. Then saliva secretion also there. Then I gave sugars in tank.
Okay.
Suddenly, in 10 seconds, he wake up.
Okay, then he wakes up without taking anything except insulin.
No,
did he take? No, he did not take insulin. Did you give him dextrose?
25%. I didn't give anything, and he wakes up. Suddenly he wakes up.
So you just gave him dextrose? Just gave him dextrose.
No. This is in I'm experienced in corporate hospital. So
Okay.
sorry. I'm experienced in corporate office.
Okay.
So there is no equipments around me. So suddenly I gave the sugars only in his mouth.
Okay. So
So suddenly he is wake up. Well, I don't know whether it is seizure or what. I don't know.
it can be scissors because it is a risk factor of DM1 that if you get hypoglycemic, there is a there is a side effect that you can have scissors. It can be,
Mm.
but it should not go to that level first. Like for reaching to that level first, many symptoms show up. So there will be perspiration, there will be dizziness, there will be cold skin, there will be this thing. What else did you say? Jitteriness. So these symptoms occur first, and after that, if unattended for a long period of time, then that patient can go to scissors. But if you have just given dextrose and the patient wakes up, then that means that it was just hypoglycemic. Scissors was not there. But you are giving dextrose, still he is having scissors. Then you have to use anticonvulsants. Then he gets sedated or calms down. Then it was surely scissors. And was there
Okay.
rolling of eyes?
Yes.
Oh, there was rolling of eyes? Yes?
I can't hear you.
Oh, yeah. So I'm saying, was there rolling of eyes? Was there rolling of eyes, tonic-clonic movement, and
Yes, tonic. It's like the clonic movement only.
just the tonic-clonic movement and no rolling of eyes?
No rolling of eyes. The
Then it was
patient.
hypoglycemia. Then it was
Okay.
hypoglycemia. It was not scissors.
Mm-hmm.
Scissors में सबसे पहले you'll have rolling of eyes. You'll have
Then
like इसमें last.
saliva secretion was more than mm, he is biting so much.
Okay, but
So
like you,
whether I want to know any correlated between hypoglycemia or seizure, it
yeah,
can be like that.
if hypoglycemia is extended, your calcium level drops down. If your calcium level will drop down, you are at a risk of scissors. That much I remember. Okay.
Mhm.
So yeah, and neonates, it's definite. I remember because when the baby goes into hypoglycemia, that's the first sign it will show, right? Hypoglycemia, hypothermia, they are the causes of scissors in baby. But in elders also, I don't think that like it reaches to that level because in adults, they first show other signs. So they will tell you that okay, I'm feeling dizzy or I am sweating too much. So then you get to know. So it never reaches to scissors, the level of scissors. But it can happen in some neglected cases or something if it worsens, right?
So what
So
is the
yeah,
between the convulsion and seizure, ma'am?
what is the difference between convulsions and scissors?
Yes. Both are same, no?
It's the same thing. It's the same thing. Convulsion is just a layman term for scissors and epilepsy.
Yes.
They're all the same. They
Yes.
all are same. In this thing, in pregnancy, it becomes eclampsia. So they are
Eclampsia.
different names, but it's the same thing.
Okay.
Okay, so clear?
Yeah. Thank you so much.
Yeah. Yeah. So today we'll be having a test, and I'll just provide you the link. I have provided you the link. Okay. Uh, you can see in your chat, I have given a question paper. Okay. Which one is this? Yeah. So you'll have 1.5 hours as everybody completes. We'll just discuss the answer afterwards. Okay. You can have a short break and then we'll discuss the answers afterwards. So you can start doing your test. Those who have attended the 50 questions, it will be like a piece of cake for you. Just saying. And those who have not done it yet, after this you will get motivated to do that also.
Good evening, ma'am.
Hi. You can please read the questions again and again because they trick you in the questions. So even if you know the answer, you will do it incorrect. That happened with me. So I'm just passing. In the end, just let me know how much marks did you get out of 22. Okay?
Madam, have you sent the questions link?
Yes. Yes.
When
It's in the
yesterday?
chat.
Oh, chart. Okay.
It's in the chat.
All right.
मैम वो आपने लिंक में भिजवाया है चार्ट?
मैंने लिंक में भिजवाया है चार्ट. मतलब
अभी के वो क्वेश्चन जो हमने करनी है 50 वो किधर है?
ये chat खोलो chat. You have to open the chat of the Zoom link.
Okay, ma'am.
Okay. And in that you'll find nclexrn neuro questions. They are not 50 questions. 50 questions won't like it will take full 2 hours and we won't be able to discuss it. And I want to see the performance also. How much are you getting? Okay.
मैम मुझे तो नहीं मिल रही चैट में.
बाकियों को मिल
नहीं,
गए? किसी को नहीं
मैम
मिला क्या?
मुझे तो नहीं.
Yeah, I'll just send
सारे
you.
ऐसे ढूंढ रहे हैं, तुक्का मार रहे हैं, किसी को कुछ भी नहीं मिला. मुझे नहीं मिला तो. मैम नहीं है चैट में.
अब मिला?
नहीं मैम अभी. हाँ अभी मिल गया, अभी मिल गया.
हाँ तो
Got it.
स्क्रॉल ऊपर करो, ऊपर भी था.
Okay, thank you मैम.
Yeah, just do it.
Yes, sir.
मैम जो आपने पिन किया वो उसमें क्वेश्चन नहीं है.
क्वेश्चन ही नहीं है. क्या है फिर?
ओके आपने चैट में भेजा है. ठीक है. मिल गया.
ओके
हाँ
मिल
जी,
गया.
हाँ जी, हाँ जी, हाँ जी.
Just click on raise a hand when your question is done, okay? And just let me know how many are correct in the column chat box.
சரி ஒன்றும் இல்லை ஒரு நாளைக்கு நான் பண்ணிக்கிறேன். நாளைக்கு அம்மா தானே நான் பார்த்துக்கிறேன் பண்ணிக்கிறேன்.
Please mute your
சரி
audio,
போடு.
Govind.
हेलो हेलो मैम
Yes.
मैम जो क्वेश्चन है उनके जो आंसर है उसको सिलेक्ट कैसे करना वो हो नहीं रहे।
आप अपनी कॉपी पे लिखो आंसर्स उसके, ठीक है, लिख के रखो।
ओके
और जब आपका हो जाएगा जस्ट रेज अ हैंड, उसमें रेज हैंड का ऑप्शन है ना, देयर इज एन ऑप्शन फॉर रेज हैंड, just raise the hand and when everyone will raise their hand I will give the answers, check the answers and let me know how much are correct and then we'll proceed with the explanations.
ओके थैंक यू मैम।
Are you guys able to do it? Just read the questions again and again. You will try to, like, you will get the answer. Even if there is a disease condition, just think, seeing the name, that what is it related to, and then remember what does it do, what does that specific part of the body do. Okay? And for nursing responsibility questions, just see that which, like, they want a safe nurse. So what is the safest options of all three, all four, or five? Just choose that. Okay? Anything that harms the patient in any way or offends the patient in any way is not done, is incorrect. Okay? Manoj, Jazzy, are you able to hear me?
Ma'am.
Manoj, Jazzy. Manoj, Jazzy left. Manoj, Jazzy has joined again. Manoj, Jazzy, are you online? If you have joined late, let me know. Okay? Farhad,
Yes, ma'am.
Farhad, you have also joined late now. Did you get the question paper?
Yeah, man, I've been doing that.
Okay. And Manoj, Jazzy, Jazzy, okay. If you're not answering, next time you people have to then come on video also. That's for sure. And Rupa is very fast. Rupa has already done. So I'll give
Yes,
you
ma'am.
just we can just see the answers for them. Actually, I think बाकियों को भी मिल जाएगा. Let me just wait. I can just reply to you. Let me see. The person is this sort of thing. Yeah, just reply to you. Mm, yeah, you can just go look at the check out the answers. Okay, I've sent you. Rupa.
Ma'am, say it again.
Okay, I have sent the answers. You can just have a look on them and then we can discuss afterwards when everybody is done.
Ma'am, where did you send the answers?
In the
The
chat,
chart.
private chat.
Okay, okay.
Did you receive it?
No, ma'am, till now I didn't receive anything.
Give it a second. Did you receive my hi?
One second. No, till now, no, ma'am. No,
I
this is
can see,
Kavaljit.
ma'am, but
Kavaljit,
I
ma'am.
am just talking to Rupa.
Oh,
Just when you're done, then you can ask me.
ma'am, I done already. I just raise a hand with the
Okay.
questions.
Sure. I don't think privately it is reaching. Rupa, did you get it?
I tried to open, but
No, not opening.
yeah, it says downloading, but I can't see it again.
And let it download. Or we can just wait. Uzma is also done. Ma'am, very difficult questions. Which one did you find difficult? We'll just discuss that. Did you do your 50 questions? They were also of the same format.
Ma'am, I don't know. I'm not able to open my answers, ma'am.
Then leave it. We'll discuss it afterwards.
Okay.
I'll
Okay.
just give it as a group. Okay. I don't know why you're not able to open it. How come? Let me send it again.
Today I'm using that iPad. It's not my regular
Yeah,
laptop.
it's slow in
So
iPad actually. Slow in iPad. Yesterday I was also trying my whiteboard now, so it was creating a sort of bizarre. Everybody could type, and I couldn't eliminate everyone. So everything was stuck. That's why I opted for PPT. But what are you people more comfortable with? Is it PPT or is it whiteboard? Because my spelling is, I mean, my handwriting is horrible. So,
We
but
are
yeah, for
flexible
tell me,
with
tell me.
the whiteboard. Hello,
Okay, you are more comfortable with
flexible with
whiteboard.
the whiteboard. Actually, we want
Okay,
to clear our concepts. You can elaborate, try to give different examples, 3 examples.
okay, sure. Then we can proceed with whiteboard from tomorrow. Okay. Mohan, what about yesterday's class? Was it difficult with the PPT? Is there anything you did not understand?
Ma'am, I didn't get your answer.
I said in the yesterday's class, I took it with a PPT. So was there anything that you had like that you did not understand or you had any doubts?
Oh, no, ma'am. Yesterday our session was good and you are elaborate very clearly and we understand most of things. I can say here, we are all over chapter and very clearly understand.
Okay, sure. Hmm. So who else have done? Hello, ma'am. Good evening. We are talking. Okay. Manoj, has he
Yeah, ma'am,
left again?
actually, ma'am, I have 2 IDs, Emmanuel Jazzy and the other one is Emmanuel Moin.
Manoj, only
Actually,
you
that
only.
time,
Okay.
yeah, that time I was on mobile, so now I'm on laptop.
Okay. Okay,
Actually,
sure.
that time I was doing walk and exercise.
Those who have done it, you can just revise it once. Usma, if you're finding it difficult, the questions, just read the questions again and again, and you'll get to know the answers in questions only. I'm telling you. If it's the disease condition, just remember what were the signs and symptoms. If you can remotely connect the disease with the part, any organ which it is related to, for example.
And where are the answers?
Answers?
Yeah,
Farhad?
where are? No, I'm saying where are the answers? You said you shared the answers also.
No, I have not shared with you. Once everybody has done, then I'll share it. Okay? Are you done with the paper?
Yeah, ma'am, I did it. I don't know how many I correct. I just did it.
It's okay. Just wait for a few, like take a break till then.
Going on.
Yeah, so
Is
as I
it
was
give
saying,
us any test?
pardon,
Sorry, is it give any test?
is it given any test as in?
Give us any test?
Will
I
I
think
give you
he
any test?
don't know. I think he don't know we are having a mock test. That's why he's asking.
Mohan, we are having a mock test.
Mock
Mohan,
test, okay.
go in the chat.
So I
Go in the
don't have
chat
any
and you.
idea about test. I'm still waiting.
Oh my God, that's
Okay.
very sad to know.
Kindly
But
share me a
in
link.
the chat, you can scroll. You can scroll and you'll see a PDF. nclexrn neuro questions. Just
Okay.
scroll above. Okay.
I'll check.
If you're not able to find, then I'll just send it again. That's why you should join on time now. Why did you join so late? Must be having any shift. These are busy people. Mohan, you're going to take one more hour then, I think. Did you get the paper?
Kindly share me. No, ma'am, I didn't get it. Kindly share me a
It's in the
link
chat.
again.
It's in the chat. I have just sent it. It's in the chat. I have sent it thrice in the chat now.
Okay. Which topic is this? Stroke?
No,
Cardiovascular stroke? Or
it's all combined. All the nervous system. Questions based on nervous system and basic nursing responsibility.
Yes. Which link, ma'am? It is it last one?
Yes.
Okay.
Once Rupa, can you tell me if you got the PPT? Then I'll send
Yes,
others
ma'am.
also personally. You got it? So I'll send others
Yes, ma'am.
also. Uzma is done, right? I just send to Uzma.
Yes, ma'am.
Yeah.
Ma'am, anybody share me link? Send me again.
Why is it
didn't
not
find
opening?
it. No, ma'am.
Can you see it in the chat? Are you not able to see it in the chat?
Which one?
It's in the chat. Hi, Mohan.
NeuroPrep.
The question paper also send on the group as well. So he can check on the group.
I have just sent it. I have just
In
sent
WhatsApp,
it.
in WhatsApp group.
No, in WhatsApp group.
Yes, ma'am.
Okay.
Yesterday,
Yeah,
second.
I'm trying to
someone-
find on WhatsApp.
Just give me a second, man. Just give me a second. I think I'm not in your WhatsApp group, so I just have to tell Sumit then.
Yeah, no,
And he must be sleeping if he's in.
yesterday, someone is sent on the group. I think sir is sent. Sir has.
This question paper.
Yes, ma'am.
It is not possible. I did not even give it to him.
I think. Let me check.
Must be another one. I did not give any question paper to him yesterday, as far as I remember.
One question, ma'am. Another question.
Why are you people confusing me? Just complete this thing now. And Mohan, did you find it or not?
No, ma'am.
Mohan, just go to the Zoom chat.
Okay.
Yes.
Just go to the Zoom
All
chat
right.
and scroll up.
Wait a minute.
Who is this? No, ma'am. Is this Mohan?
Yes, ma'am.
No, it is iPhone. Who is iPhone?
My phone, I think he's Junaid one. Junaid phone.
Ma'am, we can't hear you.
Mohan, did you get the questions? Am I audible? Am I not audible? Am I audible?
Yes, ma'am. Audible.
Mohan, did you get the questions?
Yes, ma'am.
You
I
got
get
it.
it.
Good.
nclexrn.
Okay. And iPhone.
Can sort out on our notebook these questions
Yeah,
answers.
just write the answers. Just write the MCQ answers 1, 2, 3, whichever you are
Okay,
choosing.
okay.
Okay. And
Yes.
just keep it noted, and I'll just provide you the answers. Check whichever are correct and whichever are wrong, and let me know the total score. Okay, how many were correct? Just let me know how many were correct. Okay.
Okay, ma'am.
Ma'am, how can we check how many are correct?
I will send you the answers PPT.
Okay. Okay, ma'am. The
Just
thing
let-
is that
Hmm.
I am, confused in question number 19. The two
I
options.
will tell you. I'll explain it to you. Don't worry. We
These are
have
the
one
terms.
more hour. No? We have one more
Okay.
hour. It is for discussion only.
Okay.
If you've completed, I'll just give you also. Just send me a hi on chat. Farhad.
Just
Yeah. See, I'm sending you also the answers. Just check it. Okay. Who else is done? Sasikala ji, have you completed?
Yes, ma'am. Done, ma'am.
Did you just say Jai Hind?
Ma'am, I also done, but I didn't receive any answer.
Okay, I'll just send you. Uzma, you did not get the answers? I sent it on the private message.
No, ma'am.
Ma'am, I also done.
Icon.
हाँ,
Okay.
मैम आपने व्हाट्सएप पे सेंड किए हैं?
नहीं, मैंने आपको प्राइवेट चैट जूम का प्राइवेट चैट में सेंड किया. Just scroll and you'll be able to see. Zoom में there is a private chat. Okay. I've sent you twice now. Okay. Farhad, I've sent you also in a private message. Just check on Zoom.
Yes,
And
ma'am, I
Sasikala
know.
ji is left.
I'm
Okay,
trying to
good.
open it.
Good.
Wow.
Sasikala ji is left. So if majority have completed, then I can just send it in the group. Mohan is left. Mohan will take another hour because he has just started. And
Ma'am, I'm also completed. Govindraj.
Govindraj has also completed. Maybe I'm sending everyone privately, so it's taking a lot of time. वापस से भेज दिया था तो वो don't open this really. Who else? Rupa, did you get it?
Yes, ma'am.
Who else is left? iPhone, what is your real name?
Ma'am, yes.
10 minutes wait.
Pardon?
Ma'am, I haven't received yet answers.
Have you completed the paper, Bhavna?
Yes, ma'am.
Okay, I'll just send it to you. And iPhone. Who is iPhone?
Ma'am, yes. Hello.
What is your name? I forgot
Priya.
your name. What is your name? Priya. Change your name to Priya. No? Then why have you kept that? And have you completed, Priya?
Yes, ma'am.
Okay. So tell me, whoever have received, are you able to open it?
Ma'am, I'm not received.
Whoever has received in private message, are you able to open it?
Yes,
If
ma'am.
you have not received it, it must be uploading or something.
मैम मुझे रिसीव नहीं हुआ रोजलिन सिकंदर.
Yes. It must be uploading. Just let me check once. Okay. Give me a second. I'll just check everyone. Priya, I have just sent you. Let me know if you have received it in your private message on Zoom.
मैम अभी रिसीव नहीं हुआ मुझे.
Just let me know. जो होगा. भावना, कुछ मिला?
Yes, ma'am. Yes, received.
मिल गया? गोविंद राज मिल गया? गोविंद?
No, ma'am. No, ma'am. I didn't receive.
नहीं मिल. You did not receive? Check your private
Yes.
message. It's gone
And
from you.
maybe there is a network issue. That's why it's delayed.
Everything is working fine. My video is working fine. So it should be done.
From their side.
Govind Raj, just open the private message with me. Try to text me privately on Zoom. Shashikala ji, have you received? Because it's gone from here. Okay, check the private message with nclexrn. Who else? Whoever have not received, it's gone from here. So just check your private message. And Rosaline, have you completed? I don't think I've sent Rosaline. Rosaline, have you completed? Rosaline
मैम
Sikandar?
मेरे दो. हेलो मैम, आवाज आ रही है?
हाँ जी.
मैम मेरे 2 MCQs रह गए और मुझे वो पर्सन मैसेज भी नहीं आया.
आपके 2 MCQ रहते हैं ना, तो हो जाएंगे, तो आ जाएगा. तो ये मैं भेज देती हूँ.
मैम मैंने थोड़ा लेट स्टार्ट किया था.
कोई नहीं. Take your time. And I'm just sending you the answers also. It's only 2 are left.
मैम आप मैसेज देख के मैसेज नहीं रिसीव हो.
मैं किया ही नहीं अभी. I'm just sending it right now. Okay. So check the private message on Zoom with me. I have just sent it. So अभी तो हो जाना चाहिए. Who else is left? Kavaljeet, so have I sent? I have not sent Kavaljeet also, I guess.
Yes, ma'am, I didn't receive anything.
Just give me a second. Now it's actually slow. Okay. So, Sashikala ji, are you able to open it? Did you receive anything?
Yes, ma'am.
Just send me a yes, whoever have received on the private text. Okay?
No, ma'am, I didn't receive.
Just give it a time. I just sent you. So, whoever have received, just send me a yes. Okay? Govind, Priya, this is. Yes. Okay. Bhavna has received. Govind has received. Priya, Farhad, Uzma, Rupa. Priya, Farhad, Uzma, Rupa. Just let me know in the text if you have received or not. Who else? Shahab Khan. Shahab Khan. Shahab Khan, am I audible to you?
Yeah, I hear you, madam. Ji.
Yes. Have you completed the paper?
Yeah, I am graduated student now, from Khyber Medical University, Peshawar, Pakistan.
No. What we are doing today is we are conducting a test. So I think you have just joined, right?
Yeah, today I joined your
आपने
Zoom meeting.
हाँ, so मैं ये बोल रही हूँ कि आप क्वेश्चन पेपर आप चैट में जाइए एंड आप क्वेश्चन पेपर देखिए, वहाँ पे एक क्वेश्चन पेपर होगा NCLEX RN न्यूरो का, ठीक है? चैट में जाइए,
कहाँ
जूम की
पर?
चैट में, जूम का चैट.
Okay.
Okay, there will be a question paper, try to solve it. And
क्वेश्चन पेपर तो यहाँ पर ना मैडम नहीं है.
Shahab, don't you think you have joined a little late for the class? Everyone has completed their paper and now you are joining. You must have, like, it was pre-informed that there's a test today, right?
Ma'am, only 5 questions. So I will respond you when I will complete my task.
Take your time. Shahab, I have sent again in the chat. Just open it once. You will see a PDF of NCLEX RN Neuro. Try to open Zoom chat. There is a chat column in Zoom meeting. Open it and you will be able to see a PDF. Try to open it. There is a questionnaire. Just complete that questionnaire. Okay? Take your time. मैंने कहाँ सेंड किया? किसको सेंड किया मैंने नहीं किया इनको. Rosaline, ma'am, no message received. Rosaline, go to the private chat. I have sent you. It's gone from here. Kavaljeet, have you received?
We can discuss. We
मैम
can
नहीं
discuss,
रिसीव
ma'am.
हुआ.
प्राइवेट चैट में जाओ, यहाँ से हो गया, यहाँ से अपडेट हो गया.
देखती हूँ.
See, I sent you a hi also. Yeah, we can discuss. Just give them around. Like, did you see the answers? Who was that? I think that was Sasikala, right? Or Rupa?
No.
Yes,
Rupa.
ma'am, I got 16 out of 22.
Yeah, just write your score in the chat. Just write your score in the chat.
Have you checked, ma'am? Or
Just write your scores in the chat. Whoever have received the answers. Rosie, nahi hua receive.
Ma'am, can I
Ma'am,
send on the group both the question and answers?
No, you
WhatsApp group.
can't. There are a few people who have not completed yet. So I don't want them to know the answers right away.
Okay. Yes, ma'am.
Okay, that's why I'm taking so much pain sending you privately.
Yes.
Okay, today we actually have to assess that whoever is taking the test seriously will be continued actually. Okay, so it's very important that you do it correctly, because I'm not the one to assess. Others will also be seeing your paper and they'll be assessing. Rosie, you are high also on private text. Just try to open it.
ओके मैम मैं चेक कर.
नहीं हुआ क्या बीबी? मैंने 2 बार हाई भेज दिया. Shahab Khan, did you receive the questionnaire?
Madam, I didn't receive.
भाई ये देख ना, चैट में
जी.
है. चैट में देखो. नीचे टूल बार में जाओ and see the chat. Just send me a hi
Yeah,
on chat. Send me a hi on chat.
participant.
Participants के site पे there is a chat. Open it and send me a hi on it. Yeah. Now
Yeah, I
scroll up.
sent here.
Scroll up. Scroll.
Yeah.
You see a PDF. Did you see a PDF?
No, madam, यहाँ पर PDF तो नहीं है.
Are others not able to see that PDF which I recently sent?
Ma'am, I can see.
We can
It
see,
is just
I
above.
can see, ma'am.
It is just above my. It is just above my
Sahab,
received
I have
message.
just sent it. I have just sent it. You must be able to see it.
Maybe my network issue.
Oh. Then I'll just tell him to send the question paper on your Zoom meeting. I mean on WhatsApp. What else can we do now? Sumit,
मैम मुझे तो मैसेज रिसीव नहीं हुआ. ठीक है.
ये कौन है? रोजलिन है क्या? रोजलिन ऐसे कैसे हो सकता है? मेरा हाई चला गया आपको. आप प्राइवेट मैसेजेस खोलो, उसमें
मैसेज
दिखेगा.
नहीं आया. आपको हाई का भी मैसेज नहीं आया.
It's impossible. That's what I'm saying. Just open a private text. चैट में साइड पे एक ऐसे गोला सा बना होता है ना, चैट की साइड पे, उसमें प्राइवेट DMs भी होते हैं. I've sent you. It's impossible. If others have gotten it, then you must, like, there must be some problem
पार्टिसिपेंट्स
in
के
yours.
साथ में चैट है मैम. चैट को ओपन करके ये लोग देख सकते हैं. वो अलग से आता है मेन चैट के साथ. nclexrn लिखा होगा मैम का उसमें.
I think it's early morning in Canada, so he won't be receiving my text over. So, anyways, let's see. Rosaline. Rosaline, hello ma'am, मिल गया मुझे. So, did you receive anything? Don't tell me no.
मैम कुछ भी रिसीव नहीं हुआ. सिर्फ हेलो रोजलिन आया.
और कुछ भी रिसीव नहीं हुआ?
नो मैम.
अभी? Then there must be some issue here. I'll just send the answers on the group only. Just the ones who have not completed their test, please be honest to yourself and complete it, and only then look at the answers. It's a very kind request, okay? And it's for your own good.
Okay, ma'am, I have done my 10 questions. If you give more time, that is your choice. If you are asking about on my concern,
Yeah, so
I'm honest
I
with
trust
my
you.
yes.
I
Okay.
trust you, okay? Don't see the answers. Okay, and you have done 10 questions. Till the time you'll be completed, we can discuss the 10 questions.
Okay.
Okay. Yeah, so I have sent the answers in the Zoom chat. I think everybody should be able to access it. Those who have not received my personal messages. Just check the answers and let me know how much are correct. If you want to give me a private message, you can also tell me in a private chat. If you want to tell me in a group chat, you can also tell me in a group chat. No issues. Okay, so we have the highest marks obtained is 16. Okay, and that's a good score, but it can get better.
I got 20, ma'am. I'm just.
You got 20? Okay,
Yeah,
so the highest score is 20.
Only SATA, I did one, like 2 mistakes. I got partial, so I just took 2 marks away.
Good. Given that there were a few questions which I think you won't be familiar with, I don't think all the nervous system disorders were discussed. Like there were a few very odd disorders which NCLEX gives, and like it's very difficult to cover every disorder. So just let me know if there was any such question, and we can just open the answers and discuss. If you want to take a break, you can. Just let me know. Do you want a break or shall I continue?
That's your choice. If you give us
No, Mohan, you
10
complete
minutes,
your
that's
answer.
fine.
You don't have a choice to do. You don't have a choice.
I am still carrying on.
Shahab does not have a choice. Okay, you both have to complete. Others,
I
if you
have
want to
done,
take a
ma'am,
rest.
12 questions.
Okay, ma'am, and one more thing. How should we
Hanji.
assess the SATA question? Like, if our one is incorrect and others are correct, so should we, include it in correct or incorrect?
If your one is correct and others are incorrect,
No, I mean one is incorrect or others are correct in SATA.
then okay, how many options were there? 5.
Yeah, 5 maximum.
Yeah,
Yes.
5 options. And how many were correct? Like how many were correct?
I
Like
mean,
correct
like
answers.
I have a question which I did 3 correct but 1 incorrect.
Okay, 3 correct but 1 incorrect. And total were 3 only. 3 were correct in total out of 5.
Yeah.
Answers were 3 only.
Total.
Yeah. So
Yeah.
you will get 1 mark deducted. Okay, you'll get 2. You'll get 2
So
marks.
should I? So how should I, ma'am? Should I write? Should I say that it is correct or it is incorrect? Like there are total 22 questions you sent. So how should I
No,
mark myself?
you can mark yourself partially correct, I guess. You can mark
No,
yourself
ma'am.
partially correct.
Ma'am, in
Actually,
starter
Actually,
question, there is no negative marking.
there
Starter
is.
yeah, if there is one answer, there is no negative marking. But if there are multiple answers in one question, then what happens is if you do 1 incorrect and your 3 are correct, all 3 are correct and 1 incorrect. So what will happen? That incorrect wala and that correct wala will get equalized and you'll get just 2 marks. That happens.
Yes.
And But if you leave one correct answer, there will be no negative marking for that. There is nothing incorrect, and there were 3 correct options, and you just picked
Yes.
2 correct options. So you will not get a negative marking for leaving the third one. But if you do one incorrect, then yeah, it will get deducted with your correct one. This type of thing happens, if I'm making any sense.
Yes, ma'am. It's like this.
Yeah. And to be honest,
Ma'am?
when you give the exam, yeah, tell me.
No problem, ma'am. You can continue first.
Yeah, when you give the exam, like they don't disclose the marks. They just tell you, like it's a computer-based marking, computer system-based marking. So it's very unpredictable, to be honest. They will give the questions accordingly. They will give everything is intelligence based. So they will give the questions accordingly. They will mark you accordingly. And I have till date not understood how they do the marking and how they create the percentage. Even when I was like in early days when I used to take UWorld self-assessment test now, when whole of your syllabus will be completed, you will also be getting that test. So when you take that test, they give you like a CAT exam of that NCLEX. Okay, so in that also they give us a marking. They like for them 75 above is a good marking. But in real test, you won't be able to know what is 75. Like they will not give you any percentage. So they'll just tell you you have passed or you have failed.
How many marks you used to get in UWorld self-assessment test?
See, if you are getting more than 70, 75, you are very well prepared for the exam. If you're getting more than 70, 75, you'll pass the exam. So when I started doing the exam,
So out of
doing the
total questions, madam, total questions.
Questions. See, I'm telling you again and again, I don't know about their marking because there is a CAT exam in UWorld or in any subscription. There is a self-assessment CAT exam which is very similar to NCLEX marking. Okay.
Okay.
So in that, what happens? They will give you questions accordingly, and that questionnaire can stop at 70 questions, 75 questions, 80 questions, 150 questions. 70 to 150 के बीच में it can stop anywhere. It depends on your performance. Okay. If majority are incorrect, then they will fail you and they will just ask 70 questions. Like it's not necessary. Maybe all are right and then they can ask only 70 questions, or all are wrong and then they'll ask you only 70 questions. They'll just assess you that okay, he's going to fail, so they will not give other questions. But if they are giving other questions, that simply means that your performance is nice. So
okay,
got it. Yeah. So yeah, in the CAT test, I mean in the self-assessment test, what happens is if you're getting more than 70, 75, it's generally a good score. Okay. So when I started doing, my first scoring was around 65, I guess. And then I used to do it every day. Not even, I did not go through the theory that much. I think I went through the theory in the end, but I was more concerned about the questions. And I used to practice 80 questions every day, 40 in the morning, 40 in the evening. And for theory, what I used to do, whichever question was wrong, I just used to see their rationale, because majority of the questions are from rationales only. And the rationale UWorld provides, it's very much related to the content of NCLEX. So you should always read the rationale and remember it, even if you don't remember the theory.
Yeah, man, but reading rationale of every question takes too much time. Like
I know,
No,
but
I
it is
was-
very important. Once you read it, like if there is any other question also coming, you will be like having some memory in your mind that okay, I read it about that question and maybe you'll know the answer, right? Because they give you the same matter. The matter is always the same, and they will just trick you in the question formation.
Yeah, ma'am, it takes me like 1 hour to do 10 to 15 questions. That mock test that you sent me.
Yes,
I just
you
I
have
just I just
to
do one
increase
question
your speed.
and then and then I read the rationale. Then I do another question, then I read the rationale. That is
So
how
you
I was
don't do
doing.
that now. What I used to do was in the morning, if you're doing the questions, okay, you just do the questions without reading the rationals in the morning. 40, 50, start with 40, then increase your strength. Okay, and in the evening, whichever answers are incorrect, you just see the rationals,
Okay.
right?
Okay.
Does it sound good, the plan?
Yeah, it sounds little easy.
Yeah. So don't, even if you are not willing to, like, if your exam is in 1 month and you don't have the time to read the theory, just read the rationales at least, the one we are providing. All the total kitna ho gaya abhi? 50, 60, 70, 70, 70, 80
72.
questions are done. Yeah, 72 questions. So 72 questions ka rationales, if you read now, you are done with the nervous system. I'm telling you.
Yes, ma'am, I realized it by reading the rationale of 50 questions. That I don't need to go through
Yeah.
any theories now. The rationales are enough.
Yeah. Theory is very vast and you won't be able to remember it. But the format and the context of NCLEX is this only, the rationals only. They will give you questions from that only.
Yeah.
And I think someone new joined and left. Someone joined.
And
I
then
think
right
it was
now I don't have YouWorld subscription. So
UWorld is a little expensive to be honest. So you can get the UWorld rationales and questionnaire from this coaching class. And what you can do is you can opt for a cheaper version, which is also very good. Simple nursing. I like simple nursing for that. Like they explain, and that tutor is very nice. Mike. He explains everything very nicely. I mean, you'll be able to rationalize everything then. And for questions, we are providing you with the questions. So 70 question on one
And,
topic is more than enough.
and ma'am, what about Archer?
Archer,
Archer.
I did not prefer it. It's a nice platform, but I think like all I've seen all. I've seen Kaplan books also. I've seen Archers also and Saunders also. But I think the best you can memorize the like the best content Simple Nursing provides. The best content Simple Nursing provides, and you will provide both of the things. The rationales are the best in UWorld. The questionnaire is very much relatable in UWorld, which you are doing. Simple Nursing is nice if you want a cheaper version. It's like a copy of UWorld, but UWorld tops it, to be honest. And Archers, like I think people do it, but I did not prefer it. I think the question because I
I'm
was
just
doing
saying it
UWorld
because
also, and yeah. Tell me.
I'm just saying it because my senior cleared the NCLEX recently. So she was telling me that she only did Archer and did not read any theory and stuff.
Yeah, you
Just
can
did
actually
Archer
stick
and
with
just
anyone.
gave the exam
You
and
can
she
stick
passed
with
it.
anyone. You can stick with anyone. It depends on how safe you are as a nurse. So if
Man,
your
they have
options
created too
are
much
like that,
confusion now. It is like if after failing, I was like, after failing, a person is thinking I should have done that. Why did I select this? Like it can happen, you know.
no, it's nothing like that. But yeah, see, it matters if you are sticking to one thing and you have invested your money in that. You as well like just read it. And if she read it very dedicatedly, of course, she must have cracked it. Okay. Uh, it's good. Archers is also good, but my personal preference is UWorld. That's the thing. And books are not my preferences when it comes to NCLEX because it's very difficult to complete that book, first of all. And it's very detailed. It's not detailed, you will not get an NCLEX exam. They will ask you very simple questions and very tricky way. That's all they do. They'll ask you very simple questions which you have done or experienced in clinicals, and they'll ask you it in the utmost tricky way. That's what they do.
Yeah, ma'am. This is true. My uncle, he's now just going to USA. He's a doctor. He just passed the USMLE and all. So he told me that don't go for anything except UWorld. He said that you just need to do UWorld and you can crack any exam of
Yeah,
USA.
I know. There was a mentor of mine also. before I passed it, and he also said that even if you are a layman, even if you don't know anything ABC of nursing, if you just do 60 questions of UWorld every day for 1 month, you'll be able to crack it.
Yeah, that's what he told me, man. He told me that yeah, whatever you guys study in university and stuff, it is all just useless. You
Who
just
was
need
this?
to do
Was
you
this
world
Baring?
because it.
Was this
Yes.
Baring? TJ Baring?
What did you say, man?
Who was this person? Was he TJ Baring?
No, no, ma'am. He's my uncle. Like he's also going to
Okay,
USA. He's a
sure,
doctor.
sure.
So he just got residency. So he told me that just do U World. You can crack any exam of USA by just doing U World.
That is very true. That is very true. Okay, so I'll just share the screen and we can just discuss the answers. Just give. Is everybody present now?
Yes,
What?
ma'am.
Yeah.
Yep.
You must have gone through the answer sheet, right?
Yes, ma'am. My 15 are correct.
Yeah. 15 are correct. Yeah, that's a good score. Not bad. What happened?
No, I did some
So
easy one wrong.
it doesn't matter. You'll get it right the next time. Okay? If you know. ये तो questionnaire है. There's the other one. Yeah, so is my screen paused? Review. Why is my screen paused? Yeah, all right. Okay, so are you able to see the screen? Right?
Yes, ma'am.
Screen दिख रहा है सबको? Is the screen visible?
Yes, ma'am.
Yeah, so first question was, I have not written the question. First question was, okay, I'll just look it up.
Should I read the question?
Yeah, it's better if you read it. I'll just have to stop the screen and put both. Wait, I'll just.
So the first question is, the registered nurse and unlicensed assistive person are caring for an 81-year-old client who had a total hip replacement 48 hours ago. When the UAP attempts to ambulate the client yells and becomes combative. Which of the following statement would be appropriate for the RN to make to the UAP?
Okay, so he is old and he has underwent a surgery. So he must have underwent some sort of anesthesia, or he must be having some disease condition. So what is the answer? What are the options?
One and
The
three.
first option is
What is the right one?
let the client rest and
okay, so the right answer is
should I read
assist the client back. No,
Okay.
I am able to see. So assist the client back to bed. I need to assist the client. Okay, so how many of you did get it wrong?
Yes, ma'am, I did it wrong.
What did you choose?
I choose the second one.
Oh.
Madam, I
Second one क्या है?
choose the first one.
You chose the first one. That's good to hear.
Ma'am, I choose the 1 and 3.
Ma'am, I choose 3.
Okay. So third वाला किसने choose किया? जिसने भी किया बहुत अच्छा किया.
मैम मैंने उस्मा ने.
Okay. So what made you choose the third one? Assist the client back to bed. See, are you people aware of the functions, the roles and responsibilities of RN, LPN, and UAP? No?
Madam, I think RN is a professional nurse and LPN there is a, I think it is a assistant nurse
See, yes.
having a assistant nurse
You have to
designation.
remember that the RN is always responsible
Professional.
for initial assessment. Okay. Initial
Yes.
assessment of the patient, pre-operative initial assessment of the patient, first day of pre-op. Okay. RN is responsible for that. So RN will not give any task to LPN or the UAP in that matter.
Yes.
Because anything happens to the patient, RN is responsible for that. Okay. So what she'll do, she'll assess the patient herself, right?
Yes.
And what are the roles and responsibilities of UAP? Grooming of the patient, assisting the patient to the bathroom. After 48 hours, surgery के 48 hours हो गए हैं. So UAP can carry the patient to the bathroom. Okay, no issues in that. But first day, everything will happen in front of the RN. RN will not leave the patient. Otherwise, she'll be responsible for that. But second day, say UAP can handle it. That too in presence of RN or after telling the RN. Or otherwise, he'll not do it in case of a hip surgery, for sure. Okay. RN का और main task क्या होता है? Other main task is any infusion, any blood infusion, only RN will do it. Okay. No LPN will do it. Any initial IV administration, IV injections administration, who will do? RN will do.
RN.
Okay.
Registered nurse.
Follow-up can be handled by follow-up of the medications and IVs can be handled by LPN.
Yeah.
But initial, wherever initial word comes, RN will do it. Discharge summary, discharge,
Yes.
RN will do it. Okay. No, I'm just revising it for others also. That what are the roles and responsibilities of RN, LPN, and UAP? Because आगे जाके if question comes, you won't be like there will not be any confusion. Okay. UAP is responsible for unlicensed assistant professional personnel. He is responsible for what? He is responsible for taking care of the patient, as in daily grooming of the patient, or helping him in having the food if the patient is stable, or taking him to the bathroom, giving him bedpan if everything is stable. Then, okay. In very day-to-day, like he is responsible for very day-to-day care. Okay. And LPN is responsible for what? LPN can do anything RN is doing, but she can only do the follow-up. She can't do a teaching. Teaching she can't do. Teaching is all only the RN's responsibility. Initial teaching is RN's responsibility. And blood transfusion is always RN's responsibility. Other follow-ups, LPN can help her with that. Okay. So yeah, the question is, assist the client back to bed. Okay, UAP is assisting the client back to bed because it is 48 hours ago and it is an 81 years old patient and I need to assess the client. So what do you think has happened with the patient? Audible? Hello, Priya? What were you saying? Priya?
Hello.
Yeah, what were you saying? Am I not audible?
We can hear you, ma'am.
You can hear me, no? Okay, Priya, you were saying something?
Yes, ma'am.
What were you saying? I missed it. Okay, I think you are having some network issue. Are others able to hear me?
Yes, ma'am.
Okay, so Priya, I think you are having some network issue. Or you can just write it in the chat and I'll see. Okay? Yeah, so what were you, like when you read the question, first question, what were you thinking? What would have happened to the patient? I am pretty sure nobody would have thought of delirium. Or did you? Mostly when you hear delirium, it is.
Yes, ma'am, I thought.
Oh, you thought? That's a good thing.
No, I thought, but I still did wrong, ma'am.
It's okay. Yeah, so delirium is normally you can see delirium tremens patient in ADS, in alcohol dependent syndrome. You remember alcohol dependent, alcohol withdrawal, and then delirium. You must have read it somewhere in the college. Yeah. So
Yes,
what
ma'am.
happens in delirium? Delirium occurs in old age patients. Like if it is not alcohol withdrawal, then what are the reasons? Maybe old age, then anesthesia is one reason, mechanical ventilation is one reason, hypoglycemia, hyperglycemia, patient will get agitated. Okay, we were discussing it in the initial class. So dehydration is the main reason. So yeah, is there any doubt in this question?
No, ma'am.
Do you all know what delirium is? मेरे को एक hands up
Yes,
दे दो
ma'am.
ना. Yeah, because if you
Yes,
don't
ma'am.
know, then we have to discuss this. We are not doing neuro after this. So we'll be discussing every disease condition.
No, ma'am. It was clear.
Okay. So next question is, delirium is very easy. I think people will be able to see. So 4 and 5 answer is first. Next is, a client is being admitted for a potential cerebral pathology. Cerebral pathology. I think we did this question in the previous class also. The cerebral
Yes, ma'am.
pathology is related to cerebellum. Cerebellum is related to coordination, right? So which task should the nurse ask the client to perform to assess if cerebral function is within the defined limits? Select all that apply. So first वाले में identify the number 8 placed on the palm.
Ma'am, 4 and 5.
Walk heel to toe, yeah, coordination में ये आ गया. Then touch each finger, yeah, this is for
Yeah.
balance. Touch each finger of one hand to the thumb, yeah. So
Palm.
उसमें coordination आ गया. Okay. Others are responsible for, like other cranial nerves are responsible for these other tests, which you can read. You should read these. Okay. You have read cranial nerves, right? They're just showing the assessment tests which are performed. So just read it once. Those who are not read. Okay. So third is, the nurse is talking with a client who is scheduled for a lumbar puncture. Which of the following statement by the client would require follow-up? ये तो किसी ने बहुत ही अच्छा बताया था. That first one is the answer. I will need to lie on my stomach during the procedure. This is wrong. Whenever you are having a lumbar puncture, two positions are given. First is lying lateral or sitting position.
Sitting
Then,
line.
yeah. So everybody is clear with this.
Yes, ma'am.
Fourth. Okay. Yes, the nurse is caring for a client who has a brain tumor. The client suddenly vomits but denies nausea. Suddenly vomits. Suddenly is a synonym for projectile. Okay. Projectile vomiting कहाँ होगा? Projectile vomiting occurs in increased ICP. It would be a priority for the nurse to. So priority. First thing she will do is head of the bed, healthcare provider पे डाल दो ये. Okay, जहाँ healthcare provider आ गया. See, increased ICP है, so you have to, like, if there is projectile vomiting, it is a short sign of increased ICP. If there is increased ICP, it can be because of ischemia, stroke, meningitis, anything. So you have to get done a CT or something, some diagnostic evaluation. So for that, you have to call the healthcare provider that this is the recent symptom and please follow. Okay. So that is the reason that the priority will be this. Okay. But what is the
Yes.
answer? What is the answer? Second ही है ना? हाँ ठीक है. It would have been funny अगर आंसर कुछ और होता. Second, yeah. Next question is, able to read the next question. Huntington disease का कुछ है. Okay, तो उसका आंसर क्या है?
क्यों?
Huntington disease, like, have you people covered Huntington disease? It's a very basic disease actually. किया था न्यूरो में? मैम ने करवाया था?
Yes, ma'am. Ma'am taught us about
Yes,
this
ma'am.
disease.
We
Okay,
studied
okay, good, good,
Huntington
good.
disease.
Okay. Yeah. So, Huntington disease. Okay, it is an autosomal dominant inheritance. This. तो इसमें कोई डाउट तो नहीं है ना? If there is one affected and one unaffected, dominant one, मतलब, yeah, dominant trait will go and okay. Plus, scissor का कोई question है? What is the next question, yaar? What is the next question? I don't know what is happening in this thing. Yeah. So next question is, sixth question है ना? हाँ. The
Yes.
nurse is calling. If I'm not able to read, just read the question. Now I don't know, something is up with my
I
screen
will
today.
read now.
Yeah. So the nurse is calling for a client who had a seizure 10 minutes ago. 10 minutes ago मतलब कौन से phase में होगा वो? Post. पहला phase कौन सा होता है? What are the 4 or 5 phases of seizure? 4 phases. Dominant 4 phases.
First is prodromal.
Yes.
Aura.
Yes.
Ictus, I think.
Yes.
And the post-ictus.
Ictal and post-ictal. Yeah. So post-ictal is left. 10 minutes बाद post-ictal will be the answer. यही से पता कर लो. The client is now confused and reports a headache. So these are the significant signs of post-ictal. Which of the following phases of scissor activity should the nurse recognize the client is experiencing? Okay. So you know na, in other phases is what happens. Prodominal and aura, generally the patient is not able to tell which phase is that. But there is a very slight difference in both. Prodominal just starts up like a day before, like the time lapse is more, and mostly the symptoms are same. And what the patient will experience is they must be hallucinating, confused, or not in the moment. They'll have some sort of environmental distress, or they'll not feel comfortable in the environment, or something like that. They'll not feel easy, like they'll feel very uneasy in the environment. Then ictal stage, they'll have proper the symptoms of seizures, which are loss of consciousness. We were discussing it in the beginning now. Loss of consciousness is there, a rolling of the eyes there. Then what else? Jerky movement, convulsions is there, tonic-clonic movement, repeated movements are there. Okay, so that is the ictal phase. There are other symptoms also. If you have any doubt, you can just read it. And in post-ictal phase, what happens? Patient is relaxed, first of all, confused but relaxed most of the time. Okay, and the client may also experience a headache in post-ictal phase. Okay. Any doubt in scissors? Any doubt in scissors? Yes or no? Am I audible?
No, ma'am.
I'm not audible.
नहीं,
You are
ma'am.
audible. No doubt,
Audible,
ma'am.
ma'am.
Post-ictal phase.
हाँ, post-ictal phase. तो पोस्ट इक्टल फेज, अच्छा आप आंसर बता रहे हो? या so next question is 7th है ना? हाँ, client with Alzheimer's disease. Alzheimer's disease cover हुआ था? It's covered? Just tell me yes or no if it's covered. I think it must be covered. No?
No, ma'am.
No,
नहीं हुआ?
no, ma'am.
Oh my God. बताया ही नहीं किसी ने. Alzheimer. I think we have to postpone our this thing then. Cardiac for tomorrow again. Alzheimer. Alzheimer से तो there are many questions. See, then how many of you got the answer right, by the way, for 7th?
I did it
मैम
wrong.
मैंने
I
तो
got
तुक्के से
ma'am
दो
2.
मैम मैंने तुक्के से 2 लगाया था और मेरे
अच्छा.
ठीक निकले.
मैंने 4
Okay, okay.
सेलेक्ट किया था मैंने.
Okay, but did you read the explanation? Was there any confusion in the explanation? We'll just do Alzheimer's tomorrow. We'll do it tomorrow, okay? It's an important topic, and if question will come, it will come in a series. Maybe a case study will come or something will come, okay? So questions do come with, on Alzheimer's disease. I don't know how it, like, it should not be left behind. Is found wandering in the middle of the street at 3 a.m. and is returned home by police. The community health nurse teaches the client's family members about measures to keep the client safe at home. What is the most important? Always read the most important, because when this comes, they will give 4 options which are correlating to itself, correlating to one another, and you will be very confused. Okay. So what is the most important strategy for the nurse to include in the instruction to prevent wandering? It's important that you highlight these words. Most important, sudden, priority, initial. What is the initial assessment? Who will do the initial assessment? ऐसे आता है question. Okay. Sasikala, are you trying to say something? I couldn't hear you. Can you repeat? Okay. So what is the answer? Ensure that the family members never leave the client alone. Install a door sensor to alert the family. Now, see, if you'll install a door sensor to alert the family member if the client leaves the home, everything else is self-resolvable. If the client will leave the home, you can
short-term memory loss. Short-term memory loss.
Yes, yes, yes. So notify the neighbors. The neighbors
This kind
are not
of
responsible
case
for you.
we were seeing a Gajni movie, I think so.
Never leave
We
the
did not
client
have.
alone.
Short-term memory loss.
Never leave the client alone is a good option in hospital. But
The correct
in the house,
the
in the
family
house,
member stand alone.
okay, fine. I'm saying that in the house, it's practically impossible to not leave him alone for 1 minute also, because house, like the kids are not trained for that, right? So you can't depend for that on them. So what they can do at least is put a door sensor. It's the most logical thing to do. That if the patient is going out of the house, in the house, let them wander, let them do anything. But if they're going out of the house, then you should know. Okay. If you just be with the patient all the time and they are having short-term memory loss, they will get very agitated. Obvious. Yeah. What is the answer? Answer is second. And Alzheimer's disease is an irreversible progressive form of dementia that destroys memory and cognitive function. We'll read it tomorrow. I mean, we'll do a short PPT on this tomorrow, if you don't mind. We'll do a PPT on this, and then we'll do a whiteboard teaching on anatomy and hemodynamics of heart. Okay. So the nurse in the emergency department.
Alzheimer also.
Alzheimer ही बोल रही हूँ. Alzheimer का PPT कर लेंगे कल. It's a
Yes,
very
ma'am.
easy topic, but you have to need the PPT for that because I will include more of nursing responsibilities and what should be done. I'll just see you will for that. Now I need to see the lectures for that. They keep on changing their, they keep on updating their material. So you have to see. So I'll just provide a PPT tomorrow. So then the nurse in the emergency department is caring for a client who sustained a traumatic injury 30 minutes ago and has an order of insertion of nasogastric tube. So what did you choose?
Ma'am, this is Rupa. Can I leave the class, please?
Sure.
Thank you, ma'am.
Okay. Others, what was the answer? What was the answer for this?
The correct answer is 3, madam. I think the correct answer is 3. Moderate amount of bright red blood oozing from a cheek. No. 4. Nasal drainage collected on right cause.
You are studying neuro. If you see, nasal drainage collected on sterile gauze that has a red center surrounded by a serous fluid.
Yes,
The
ma'am.
correct
Fourth only correct answer, ma'am.
Answer is 4.
Fourth is the correct. Everybody knows this. This is called halo sign. And if this is showing, that means CSF is leaking from somewhere. Needs urgent attention. Okay. Ninth is the nurse provides education for caregivers of a client with Alzheimer disease. Alzheimer फिर से आ गया. Oh my God, you people have not done it. Which instruction should the nurse include? Select all that reply. क्या तुक्का मारा?
Ma'am, 2 and 3.
Ma'am, 4.
2,
Ninth
3
question,
and
ना?
4, ma'am.
2, 3 and 4. चलो जिसने भी किया, it was very accurate. And this we'll do tomorrow. So no need to read the rationale. You can read it by yourself. Okay. 10th question is. क्या हुआ?
1 to 3, ma'am.
1 and 4. 5.
1 and 5. The nurse is moving a finger in a horizontal and vertical. Yeah, vagus है क्या? नहीं. Horizontal and vertical motion in front of the client's face.
Oculomotor.
No, ma'am, they are checking eye
oculomotor.
movement.
Yeah.
2, 3 and 5,
Sorry.
ma'am.
Which of the following cranial nerves are assessing? Okay. Motion and oculomotor.
3.
What else? 2, 3 and 5.
5.
ये बोला हाँ 2, 3 and 5. किसी का गलत था तो उसके फंक्शंस पढ़ लो. ये टेबल बहुत ही important. This is the most important table. Just ratify it. Memorize this table before going to the exam. Just memorize it. After that you can forget it, but memorize it for the exam. Okay. The nurse is assessing a client with newly diagnosed myasthenia gravis. तो आप लोगों ने पढ़ा है, I know. Which of the following findings would be consistent? क्या बोला? Difficult chewing? Rigidity?
Yes, ma'am. Difficulty in chewing, dropping eyelid, and
Ma'am, it's a 3
reflexive
and 2.
headaches.
Okay, so everybody
Two,
got it
3
right?
and 4.
इसमें मस्कुलर जंक्शन हो जाता है, मसल वीकनेस हो जाती है माइसीनिया ग्रेविस में.
3
तो
and
2,
2.
3, 4 है.
4.
Ma'am, 2 and
Everybody got it right?
Swimming.
yes.
Everybody
ma'am.
got it right?
Yes,
Yes, ma'am.
Yes, ma'am.
So you're clear with the topic.
Yes,
The
right,
nurse
yeah.
in the emergency department is caring for assigned clients. The nurse should first assess the client with. ये बताओ, ये priority basis वाला question है और ये बहुत आता है.
Ma'am, second.
Second, ma'am.
2.
Second, an
4, 1, I
epidural
think.
hematoma.
4, 4.
Unilateral facial
Unilateral
pain.
elevation.
Multiple sclerosis who is reporting blood vision. Bell's palsy who has unilateral facial drop and drooling.
Priority was second one, ma'am.
किसमें
Decreasing
सबसे
level
पहले
of
आपका
consciousness.
इसमें बस आपको ये देखना है सबसे पहले मरने कौन वाला है. जो भी सबसे पहले मरने वाला है वो
Oh,
आपकी
ma'am,
प्रायोरिटी है. ओके. So
epidural hematoma, that means that would be increased level of.
हाँ. हेड इंजरी वेरी इंपॉर्टेंट. ओके, हेड इंजरी से ज्यादा इंपॉर्टेंट क्या होगा? हार्ट. तो अगर हार्ट का कुछ आ गया, अगर इसमें एक ऑप्शन होता MI, फिर क्या आता? फिर MI आता, क्योंकि पहले जान बचानी है. जान बचाना इज द प्रायोरिटी. ओके, so you have to see by that. I think I must have written somewhere in my NCLEX notes. There is an order जिसमें आप जाते हो ना. I'll just give it to you tomorrow. I'll just like tell you tomorrow. There was an order in which you go, yeah. So priority is, oh no. So the priority is first is brain. So epidural hematoma will be first, even if myocardial infarction is there. Okay?
Yes.
And also
Second,
decreasing level of consciousness.
yes,
So we have
yes.
to pray.
Anything related to your brain, is the most important thing. It's the priority. Okay. After that, your lungs. Okay. Write it down somewhere. I also wrote it down. So you also write it down. Okay. First is brain. Anything related to brain, loss of consciousness, hematoma, head injury, you will assess first. You will attend that patient first. Then you will attend your lungs ka patient. Airway related any patient. Okay. Then you'll attend that. Once that is stable, the third priority is heart. Then you'll see heart ka. But that, चलो ठीक है. अभी आगे कार्डियक में पता लगेगा. बाकी अभी के लिए तो यही है. Yeah. So 12th question is done. 12th में क्या था आंसर? एपिड्यूरल हेमाटोमा. किसी का गलत हुआ?
No, ma'am.
समझ आ गया ना? वैसे हेमाटोमा कुछ ब्रेन में हुआ है, तो सबसे पहले वो देखेंगे हम. Okay. 13th is the nurse is feeding a client who experienced the right-sided stroke. Right-sided stroke is left-sided hemiplegia. Has dysphagia, hemianopsia, and which of the following actions would be appropriate for the nurse to take? So what are the right answers?
Ma'am, 1, 4, 5.
1,
1,
5.
4, 5. 1, 4, and 5. Placing food on the stronger side of the mouth. One side is hemiplegic. So try to you just have to apply basic nursing here. Okay. So anyone got it wrong? Anyone got this wrong?
No, ma'am.
3 words correct and one
Yes, ma'am. I didn't select fourth options, ma'am.
is
I
wrong.
select the
Three
food,
is right.
drink your fruits and smoothie. And now I select it, ma'am.
Okay, it can be a bit tricky, but just read the questions and answers again and again, and you'll try, you'll improve.
Sure, ma'am.
Yeah. So the nurse is caring for a client who is experiencing a tonic-clonic seizure. Which of the following actions should the nurse take? Select all that apply. I want Sasikala to answer this.
Ma'am, 1, 2.
Sasikala, you are
Yes,
Sasikala?
ma'am.
You're not Sasikala. Sasikala will answer today.
1, 2, and 4, ma'am.
2, 3, 4. 2, 3, 4. Which question was
1,
this?
2,
14th,
and
na?
4, ma'am.
2 and 4. Okay.
Yes,
1,
ma'am.
you did not do the first answer. Prepare to suction the client. Okay. Why are we suctioning the client?
Because of aspiration.
Aspiration, yeah. So I think you did not read it twice. Always read your answers thrice. Always. You will have plenty of time. I don't think time is the problem there because it's a 5-hour test. You will somehow be able to complete it. Okay. So read your questions twice. You should not miss these very simple. These are very simple points and very easy marks to gain. Okay. As you progress with the paper will start getting difficult. So you should
Ma'am,
try your best to score. Yeah. Tell me.
I have one question, ma'am. that if
हाँ जी
you can read option number 5, use a tongue blade to depress the client's tongue. So ma'am,
हाँ क्योंकि
as a
टंग
nurse, we
फॉल हो जाता है ना, टंग फॉल हो जाता है तो वो भी आपको एयरवे में दिक्कत करेगा। जिनको सीजर होते हैं उनका टंग ही
no,
फॉल हो जाता है
yeah.
कभी कभी बीच से, या फिर टंग बाइट
So we
करते
would
हैं,
not
वो
met.
दो चीजें होती हैं।
Yes, ma'am.
हाँ जी बताइए।
So my question is, so we would not try to depress the tongue with a blade.
ब्लेड से उनका मतलब वही है, वो जो आता है
वही,
उनका गैग, क्या
yeah,
बोलते
the
हैं उसको?
tongue blade, ma'am.
Airway,
एक टंग
Because
ब्लेड
ma'am,
होता है, गुडल्स एयरवे,
when the
गुडल्स
person,
एयरवे,
airway,
गुडल्स
airway.
एयरवे, गुडल्स एयरवे you can use, or you can use the tongue blade. Why? What was your question? You don't want to use the tongue blade?
wait, let me see.
In that
No,
Ma'am,
it's
situation,
not
patient
here
going
exactly
to
a
be
blade.
bite
It's a metal. It's a
their
metal.
no,
tongue.
ma'am, here the
Have
thing
to
is, ma'am,
provide the
they are,
airway clearance, ma'am. Because of airway clearance, we have to use the tongue blade, ma'am.
yes,
Prevent the tongue bite. So fifth one
yes,
also
but
correct option.
yes,
Okay.
but here,
Use a tongue blade to depress the client's tongue. So यहाँ पे क्यों
yeah,
नहीं
but
दिया फिर fifth भाई?
yes,
कुछ तो
ma'am, I've
reason
selected
होगा.
the 5th one. I selected 1, 2, 4, and 5, but
What is
the
their
5
reason?
one is
During
wrong.
an active scissor,
I
nothing
also
should be
selected like
inserted.
that.
Oh, maybe they have updated the guidelines. We used to do it. Everybody used to do it. They have the latest guidelines. Okay. So you have to go by
When
USA's guidelines.
nothing should
They
be
don't put
inserted
anything
into
on
the
the mouth.
client's.
Yeah, they don't put anything in the mouth. What they do is they give a sideline position and they try to suction it every time so that there is no aspiration or anything. Okay.
But ma'am,
But
patient can bite his
I
tongue
yeah, I know,
while
I
having
know.
seizure.
But they are saying, if they are saying like that, so they must be having their own protocols, no? So I can't comment on that. But yeah, this is done in India also, so I can relate to you. We also used to
I
put
did it.
Goodell's Airway. We used to
No,
put Goodell's Airway.
I did this one wrong because I was solving some other questions on the other website. There it was right, but here it is wrong.
Just remember it, just by heart it, because this is the latest guideline, and you should remember this one. I know I can relate to your feelings, but still, okay?
No, sure,
If it comes in
sure.
NCLEX, if it comes in exam, question comes in exam, don't do that. Don't use the tongue blade according to them. Okay?
Okay.
I know there are certain protocols that we follow, but they don't follow. So maybe. What is the reason? What did they give as a reason? During an active scissor, nothing should be inserted into the client's mouth, especially if the teeth are clenched, because this increases the risk for injury. Okay, so tongue bite तो वो करेंगे ही. So maybe they just observe the patient if he is not biting the tongue or something. I don't understand the reason also. But remember, okay, and I'll just do some research and see why have they done this, and why are they not opting for it. Maybe there should be another reason also. Okay, so I'll just see to it. Just write it down. Tongue blade क्यों नहीं use करते यार ये लोग? We'll just see this. Okay. Next question is, और किसी उसमें तो नहीं था ना? बाकी सारे तो सही थे. और क्या क्या करते हैं वो? Privacy provided as soon as possible. Oxygen and suction apparatus available होना चाहिए. Side rails तो पक्का ही up होने चाहिए. Padded होना चाहिए. Sideline position होना चाहिए. Loosened clothing होना चाहिए. Bed in lowest position होना चाहिए. Okay.
Madam, according to my opinion, the tongue blade is soft, so maybe the patient can crush the tongue blade into your mouth during seizure. So the tongue blade
Yeah,
is not.
actually tongue blade is metallic. Tongue blade is metallic. It's made of a metal. So maybe they don't use it.
Tongue depressor, ma'am. One of
Yeah, tongue depressor. It's made
wooden and
of metal, right?
second one is iron blade.
Yeah, so what I am trying to say is that tongue blade is made of metal. So maybe they don't put metal in the mouth because there will be any injury with that. But I think Goodell's Airway is okay because it's plastic and it will not harm the patient and it's
Yeah,
very soft. Yeah.
Airway is best.
So I'll just check it out and I'll let you know if they are banning Goodell's Airway also at the time of scissors. I'll just check it and tell you. I'll get back to you. The client with a C3 spinal cord injury has a headache and nausea. The client's blood pressure is 170 by 100. How should the nurse respond initially? क्या आंसर इसका? कोई आंसर?
And blood pressure would be our, priority here. So hypertensive medications.
Blood pressure should be priority. Lower the head of the bed. Palpate. Initial बोला है उन्होंने. ये initial respond होगा हमारा. Okay.
Antihypertensive
वाला क्या है?
medication.
Palpate the client's bladder. Palpate the client's bladder is initial response. And I think we have done this question and we did this question in the class also yesterday, if you remember. And
Yes,
उसमें भी हमने ये डिस्कस किया था
Yes,
कि क्या डिस्कस किया था बताओ. बताओ क्या
And
था.
we discussed that any injury above 3/6,
Yes.
we need to, check the bladder.
Yes. क्योंकि रिफ्लेक्सेस, नमनेस कुछ तो होता होगा. क्या होता है इनको? ऑटोनॉमिक डिस्लेक्सिया. ऑटोनॉमिक डिस्लेक्सिया हो जाते हैं. होने के चांसेस होते हैं, हो नहीं जाता है. So it's an acute life-threatening response to noxious stimuli which clients with spinal cord injuries above T6. इसमें बहुत क्वेश्चन आते हैं. above T6 है तो क्या, below T6 है तो क्या. ओके, तो ये रैशनल रट लो. ये रैशनल रट लो मतलब रट लो. एक ये रट लो, एक रेनियल नर्व वाला रट लो, और स्ट्रोक का कोई भी क्वेश्चन है वो भी रट लो. हाँ जी. Okay. So I think we have discussed this earlier also, so I'm just moving forward. Next, 16 सबका सही था. 16 question गलत हुआ किसी का? The nurse is caring for a client who had a transsphenoidal hypophysectomy and developed diabetes insipidus. Which of the following findings would the nurse expect to observe? क्या क्या है इसका आंसर? 17, 16 है ना. 1, 2 and 3. 1, 2 and 3. किसी का गलत हुआ, किसी को समझ नहीं आया. समझ तो नहीं आया होगा. Transsphenoidal hypothectomy. It's a surgical procedure, okay, of removal of the pituitary gland. यही से पढ़ लो, इतना ही है ये procedure. इससे ज्यादा इसका कुछ है नहीं है लाइफ में. तो अगर इस पे आएगा तो इस पे एक क्वेश्चन आएगा. Pardon?
Partial removal of pituitary gland.
मैम मुझे सुना नहीं.
Ma'am, can you hear me?
या ये सुन गया.
Partial removal of pituitary gland.
Yeah. So what I'm saying is that there will be some questions just like that. Like you'll just get one question. So you read the rationale for that. You can't make a whole PPT on the surgical removal, right? So just read the rationale and try to remember it. Okay. Try to remember it with the name of the surgery and how it is related to the removal of the pituitary gland. Just try to remember, because only one question will come and it will be from this paragraph. Okay. So just try to remember all these symptoms: polydipsia, polyuria, increased serum osmolarity. Just try to remember. Okay. Is there anything you don't understand in this? That what is the surgery? Pituitary gland का कैसे होता है surgery? Is there anything that I have to tell in this?
Not me,
Or is it? हाँ, तो समझ आ गया ना ये? इसमें कुछ समझाने वाला तो नहीं है ना?
Yes.
Okay. Just remember pituitary gland क्या करता है and उसका removal करना होता है, उस surgery को क्या कहते हैं, and what are their signs and symptoms. That's all.
Everything was
Okay.
easy, ma'am. I was just confusing in one thing, and
हाँ जी.
that was that why serum osmolality is increasing. My concept is little weak, particularly this
Serum
area.
osmolarity is increasing because there must be a hormonal change. Pituitary is responsible for hormones. तो antidiuretic होता है, क्या होता है यार, एक मिनट तो, pituitary gland and endocrine gland that produces, stores and excretes hormone. Example, antidiuretic hormone. So pituitary gland is related to, it secretes antidiuretic hormone. Diuretics क्या करते हैं, आपका सारा फ्लूइड निकालते हैं.
Waste water,
एंटीडायोरेटिक क्या करते हैं, उसको प्रिजर्व करते हैं.
will
तो
store it.
ऑस्मोलैरिटी, हाँ तो कुछ समझ आया. ऑस्मोलैरिटी उसमें से इफेक्ट होती होगी ना. इफ योर ADH is not working, your antidiuretic hormone is not working, then it will automatically reflect on your renal function. It will automatically reflect on your osmolarity, right? ग्लोमेरुलर होते हैं, ऑस्मोलैरिटी होती है, वहां से वो खींचते हैं न्यूट्रिएंट्स, फ्लूइड्स देते हैं उनको, है ना. वो
Yes, I
डायग्राम याद आ
understood,
रहा है
ma'am.
रीनल फंक्शन का. या so that's how it affects, nothing more. Just read the hormones it is responsible for, pituitary gland, and you'll be able to see the functions and you'll be able to correlate. Okay.
Okay.
और कोई डाउट है?
No, ma'am.
So next question is, the nurse is caring for a client at the scene of a motor vehicle collision who has a suspected spinal cord injury and reports neck pain. Which of the following actions should the nurse take? Select all that apply. ये तो easy होगा.
Yes, ma'am.
सारे ही हैं. सारे ही हैं.
1, 2, 4, 5.
बहुत ही बढ़िया. तो इसमें तो कोई डाउट नहीं होना चाहिए, आई बिलीव. ओके, ये देखो, सर्वाइकल इंजरी होती है तो हिलाते नहीं है उसको, पूरा का पूरा हिलाते हैं. हेड गलती से ऐसे नहीं कर देना. ओके, पूरा इमोबिलाइज करेंगे उसको, वैसे का वैसे ही
डेथ भी हो
साइड पोजीशन
सकती है
देंगे.
पेशेंट की, इसमें डेथ भी हो सकती है पेशेंट की,
हाँ जी, हाँ जी, हाँ जी.
क्योंकि
So we
एक
have to
दफा
carry the
न्यूरोसर्जरी
patient.
में यस मैम ड्यूटी कर रहा था, पेशेंट को अटेंडेंट विदाउट परमिशन वॉशरूम ले गया और वहां सडनली उसकी डेथ हो गई थी, क्योंकि उसके
ऐसे
सर्वाइकल को
केसेस तो होते हैं, या ऐसे केसेस हो सकते हैं, वेरी कॉमन इन सर्वाइकल फ्रैक्चर्स एंड सर्वाइकल स्पाइन इंजरी, सॉरी. तो और प्लीज स्पाइनल कॉर्ड याद कर लेना, ठीक है, कि कौन कितना होता है, सी कितना होता है, टी कितना होता है, एल और कितना होता है एस. याद कर लेना प्लीज, अपने लिए याद कर लेना, आएगा, इम्पोर्टेंट है वो. 18th है, the nurse assesses a newly admitted adult client on a neurological inpatient unit. Which assessment finding require immediate follow-up by the nurse? Nursing responsibilities बहुत है, तो बताइए. Any idea? 18th का क्या आंसर डाला है आप लोगों ने?
2, 3, 4, 5
1, 3, 4, 5 तो नहीं दिया हुआ यहाँ पे, पर क्या है 5? Toes point towards the sole of the foot. Toes
ma'am,
point towards the sole. Okay,
no,
ये
ma'am,
तो
it
foot
is a
drop हो
normal
गया.
sign.
of direction.
If
Yeah,
it is,
it's a normal sign.
yeah, if it is good.
Cannot flex the chin towards the chest. ये नहीं कर सकता, तो ये तो आपका increased ICP का साइन होता है. ऐसे नहीं कर पाएगा
One,
तो उसको फिर उसका
1, 3 and
हाँ
4.
1, 3 is new onset of right arm drift.
I did 1, 2, 4.
Increased ICP.
Ma'am,
हाँ.
this question was
Pupils
also
8
in the
centimeter,
previous.
8 mm.
This question was also in the previous mock test, ma'am.
Okay, thank God, someone has done it. Assessment of a client with a history of stroke reveals that मैंने बोला था, if you do that test, you will be able to crack this.
I did this one
Assessment of
wrong,
a
ma'am.
client.
This one
Assessment of
that
a
you are
client.
reading.
Okay. Assessment of a client with a history of stroke reveals that the client understands and follows commands but answers questions with incorrect word choices. Oh.
I was confused in the terminology.
कैसे कंफ्यूज हो आप? अगर उसको स्ट्रोक का हिस्ट्री है.
The first two, aphasia and aprasia, they both are same.
अफेजिया क्यों?
Answer question.
मैंने बताया नहीं था कल अफेजिया क्या है।
आपने बताया इनएबिलिटी टू स्पीक।
हाँ तो 19
तो
का
मैम
वन
ही इज
आंसर है
सेइंग दैट
इसका।
the person can speak but he is
Which
answering wrong.
communication?
Question is like
अच्छा, ओके,
he is
इट्स ओके, यू गेट टू नो। कंफ्यूजिंग क्वेश्चन भी तो देते हैं फिर ये लोग, ऐसे थोड़ा है, कंफ्यूज भी
Madam,
तो करेंगे।
answer is to apraxia.
इसका आंसर क्या था? वन था ना? ओके।
yes ma'am
Aphasia refer
I
to
marked
impaired
approx.
communication. Impaired communication due to a neurological condition. Example: stroke, traumatic injury, blah blah blah. The term aphasia is interchangeable with dysphasia, although aphasia is used more commonly. वैसे aphasia तो यही होता है कि unable to comprehend, unable to communicate. तो यहाँ क्या लिखा है? हमने क्या बोला था? unable to communicate, right? हमने कल ये बोला था
Yes.
ना? इन्होंने इंग्लिश में कंफ्यूज किया हमें यार। Assessment of a client with a history of stroke reveals that the client understands and follows commands but answers question with incorrect word choices. हाँ तो comprehend ही तो नहीं कर पा रहा, कैसे communicate करेगा? First ही होगा। The nurse documents the presence of which communication deficit?
But ma'am, their statement is saying that the patient is understanding everything and answering also, but answering wrong, using wrong words. So this is where they confuse us, ma'am.
Oh.
Inappropriate word.
Aphasia is difficulty in speech.
चलो प्रैक्टिस हो गया कि ऐसे भी क्वेश्चंस आते हैं, और मैं क्या बोलूं, दिए तो मैंने सारे वही हैं सैंपल क्वेश्चंस एनक्लेक्स के पुराने। एफेजिया सिंड्रोम क्या क्या होता है? स्पॉन्टेनियस स्पीच, कॉम्प्रिहेंशन कैसा है? स्पार्स। ओके, तो ओ यार, ये मैंने पढ़ाया तो है तुम लोगों को कि एक्सप्रेसिव और रिसेप्टिव। तो एक्सप्रेसिव वाला इज स्पार्स एंड नॉन फ्लुएंट, रिलेटिवली प्रिजर्व। डू यू रिमेम्बर कल की स्लाइड्स में आई डिड टेल यू in the end that there are two types of aphasia. One is able to comprehend but not give the answer, and उनको हम comprehend के लिए I mean communication board देते हैं and वो सब, and the other one is not able to comprehend. Remember कल का एक स्लाइड था, लास्ट स्लाइड था वो, तो वो एक जो स्लाइड था वो इम्पोर्टेंट स्लाइड था, तो उसको आप दोबारा देखना चाहके उसमें वही लिखा हुआ है कि पहला वाला एफेजिया के दो टाइप के होते हैं, तो ये दूसरी वाली टाइप है कि वो समझ रहा है सब कुछ लेकिन वो बोल नहीं पा रहा है, ढंग से बोल नहीं पा रहा है, कैसे ना कैसे वो कर रहा है, थोड़ा बहुत बताने की कोशिश कर रहा है लेकिन नहीं बोल पा रहा। ये एफेजिया का सेकंड टाइप है। पहला टाइप है कि कुछ बोल ही नहीं पा रहा। हाँ, सो देन ठीक है, तो बस ये एक बार दोबारा पढ़ लेना और कुछ नहीं है, वो कल का पीपीटी देख लेना। नहीं समझ आया क्या अभी भी? सबका एक बार मीनिंग पढ़ लो, लिख के रख लो।
Yes ma'am, I understood.
You must have read all the fours, ना? It's very confusing, I know. तभी मैं बार बार बोल रही हूँ कि it's very tricky. They will trick you in questions. That's why I read the questions again and again. After that also you tend to do some wrong questions, even if you know the answer. ऐसे ट्रिक करते हैं लोग। But once you will be able to do, like अगर आपने ज्यादा क्वेश्चंस कर लिए होंगे ना, तो फिर आप रूल आउट कर पाओगे कि ये क्या पूछना चाहते हैं। So 20th है, the nurse in the outpatient clinic is speaking with a client diagnosed with cerebral arteriovenous malformation. Cerebral arteriovenous. Okay, which statement would be a priority for the nurse to report to the healthcare provider? क्या लिखा है इसका?
मैम फोर्थ वन।
पढ़ा है ना वैसे arteriovenous malformation?
यस मैम।
बस ठीक, आता होगा फिर तो। The client is diagnosed with the right-sided Bell's palsy, तो पढ़ा है आप लोगों ने। बताइए इसका आंसर क्या है?
वन टू फोर।
Bell's palsy 1 3 4
1
1
3
to
4
4।
1 3 4 2 on the left side blah 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 blah. इसमें कोई explanation चाहिए? बेल्स पाल्सी में कोई डाउट? बेल्स पाल्सी पढ़ा है?
No, no. Yes,
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 ma'am.
ma'am. Yes, studied it.
इसमें कोई डाउट?
No.
No,
इनके
ma'am.
क्वेश्चंस के अकॉर्डिंगली उनके सिम्टम्स देख लो और वैसे ही पढ़ लो, एक बार रैशनल जरूर पढ़ लेना, रैशनल पढ़ लेना, बार बार बोल रही रैशनल पढ़ लेना, यही क्वेश्चंस
Ma'am,
घुमा
I
के
was
दूसरी तरह से देंगे.
in Ball's palsy. In Ball's palsy, ma'am, there was only one confusing point. You know, meticulous
बताइए.
oral hygiene. Like you have to do excessive brushing, excessive cleaning of the teeth.
कहाँ पे लिखा है? अवॉइड ड्राइविंग, च्यू ऑन द लेफ्ट साइड, मेंटेन, कौन सा वाला था? मेंटेन
Meticulous or
मेटिकुलस ओरल
Yeah,
हाइजीन.
oral
meticulous oral
hygiene.
hygiene, like excessive
तो
cleaning
यहाँ
of
क्या
the
लिखा है?
teeth and gums.
ओके. च्यू ऑन
मैम
द
ये
अनअफेक्टेड
काफी
साइड टू
क्वेश्चंस
प्रिवेंट.
हमने पहले भी प्रैक्टिस किए हुए हैं, बट इन्होंने थोड़ा डिफरेंट करके सिनेरियोज दिए
मैं
हैं।
बोल रही हूँ ना, सेम टॉपिक होगा, क्वेश्चंस को घुमा के देंगे वो,
ऐसे
और
सिनेरियो
कुछ
चेंज
नहीं है.
कर देते हैं।
हाँ, तभी कह रही हूँ रैशनल रट लो, क्योंकि
जैसे
कंटेंट
अभी
वही है.
एक क्वेश्चन आया
दैट
था,
इज द
उसमें
कंटेंट.
जो हमने लास्ट पढ़ा तो उसमें डिस्फेजिया आ रहा था, बट इधर आ रहा था स्विमिंग साइन आ रहा था। जरा मसल वीकनेस है तो उसको वो
हाँ,
छुपाने में और डिस्फेजिया होगा, खाने में मुश्किल होगा, तो थोड़ा चेंज करके
चलो
देते।
ऐसे ही है, मैं बोल रही हूँ. Chew on the unaffected side to prevent food tapping. A soft diet is recommended. Maintain good oral hygiene after every meal to prevent problems from accumulated residual food. So parotitis or dentitis 3 and 4. तो ओरल हाइजीन मेंटेन करना है ना, मतलब क्या प्रॉब्लम है? मेटिकुलस ओरल हाइजीन में क्या प्रॉब्लम है?
Ma'am,
Ma'am,
डाउट
meticulous
क्या है?
avoid
meaning just
driving is not the correct answer. Like
it is correct.
avoid
करेक्ट
driving.
तो है, ड्राइविंग तो अवॉइड करनी है. 1 3 and 4 है ना आंसर.
Yes.
But option second is avoid driving.
अवॉइड, अच्छा हाँ. Select all the above instructions to the nurse give to the client for care at home. Avoid driving शायद obvious है. Vision, balance, consciousness, extremity,
Yes.
motor functions are not
They
impaired with
haven't
Bell's palsy.
give this option in the answer.
They want a Bell's palsy patient to drive, according to them.
Seriously, like how is it possible? Like brain palsy patient is can drive.
Because vision, balance, consciousness, पर उसका activities मतलब rendered हो गई होंगी, तो it should not be come to that a Bell's palsy patient is driving. But they are saying that vision and balance, consciousness and extremity motor function are not impaired with Bell's palsy. ये कब का patient है? Client with diagnosed with right-sided Bell's palsy. कराना तो नहीं चाहिए.
Yes, ma'am.
What instructions should the nurse give the client for care at home? पर अगर हम उसको घर भेज रहे हैं, right-sided Bell's palsy वाले patient को, तो I think उसको सही करके ही भेज रहे हैं, जब वो पूरा उसका चलने लग पड़ा हो.
But ma'am, it would be like their rules
या
maybe
यही है इनका
because
इकलौता मतलब यही दिख रहा है मुझे.
their driving rules are
कि
strict, ma'am. It is not like Pakistan or India.
yes, their driving rules are strict, so as their discharge rules are. So what I'm saying is, if they are sending the patient on discharge, a Bell's
किधर जा
palsy
रहे हो?
patient,
टाँके खोल दिए वो?
तो
क्या आके खोले?
खोल दिए. प्लीज म्यूट कर लो अपना, प्लीज अपना म्यूट कर लो मोहन.
ओके 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 ओके.
मैं बोल रही हूँ कि if they are sending the patient to home, they'll make sure कि वो उसका सारा डिसॉल्व हो गया हो, हिस्ट्री के साथ ही भेजेंगे उसको, पूरा रिकवर करके भेजेंगे. That is what is making sense. Otherwise, why would they allow them to drive, right?
Yes, ma'am.
And to be honest, जब भी हमने देखा बेल्स पैल्सी का पेशेंट, तो हम उसको पूरा ठीक करके भेजते हैं ना. नीचे से ऊपर तक शुरू होता है, ऊपर से फिर नीचे जाता है. पूरा ठीक करने का वही 1-2 महीने का जो जितना होता है वो सारा करके भेजते हैं उसको आईसीयू से, है ना. So that may be the reason. तो तभी कह रही क्वेश्चन बार बार पढ़ लो, उसके बाद भी गलत होता, मेरा भी होता है ये तो. अवॉइड ड्राइविंग तो मैं भी करती हूँ.
Yes, ma'am.
रट्टा मार लो, मैं कह रही हूँ रट्टा मार लो. कैसे ये क्वेश्चन फॉर्म कर रहे हैं, कैसे बोल रहे हैं कि अच्छा घर भेजा है तो बेल्स पैल्सी का पेशेंट है, पूरा ठीक
That's
करके
why
घर
we
भेजा
have to
होगा.
practice
ठीक है.
question rather than theory.
यस Yes. That is the only reason. That is the only reason I'm saying. क्योंकि हमारा रैशनल गलत नहीं होगा, लेकिन उनके क्वेश्चन के हिसाब से गलत हो जाएगा. Okay.
Yes, it's completely different between India and of like abroad countries. Like
Of course, yes. अभी तो इनका वो
big
पढ़ना,
difference.
इनका immunization schedule is totally different. इनका HIPAA, ethical, legal issues, वो भी बहुत इनके strict हैं, वो भी बिल्कुल different है. Drugs का इनका बहुत, drug compliance इनका बहुत strict है.
मैम आप ही करा
वो
देना.
questions तो ये U-World के होंगे, मैं करवाऊँ कोई भी कराए. The nurse is assessing a client with advanced amyotrophic lateral sclerosis. पढ़ा है क्या? Amyotrophic lateral sclerosis. Lateral sclerosis.
ऐसे ही पढ़ा है थोड़ा बहुत
ही जरूरत थी वैसे. Which of the following assessment findings does the nurse expect? कुछ idea? Sclerosis है तो क्या ही होगा?
Yes, मैम difficulty breathing होगी, swallowing, weakness होगी.
सही था कि गलत था?
सही था मैम मेरा तो.
It was easy. Just
2, 3 and 4. 2, 3 and 4. Difficulty swallowing, breathing, tremor. वही सारे multiple sclerosis वाले आ गए. Muscle weakness भी होना चाहिए था, वैसे पता नहीं क्यों नहीं है.
है मैम muscle
डायरिया तो
weakness
नहीं है.
है.
yes, ma'am. Muscle
2,
weakness is the
3,
answer.
4. हाँ, muscle weakness
Correct.
है. Resting tremor नहीं है. हाँ. Then
Yes,
डायरिया
ma'am.
भी नहीं है. ठीक है. ओके. मेरे को लगा अब इसका भी कोई आंसर नहीं होगा मेरे पास कि इन्होंने amyotrophic lateral sclerosis. तो ये पढ़ लेना, छोटी सी डिजीज है, बस इतना ही है इसका, जितना इन्होंने पैराग्राफ दिया है.
ओके मैम.
ओके. रेस्टिंग ट्रेमर किसमें होते हैं? पार्किंसनिज्म. पढ़ा है पार्किंसनिज्म? पार्किंसन पढ़ा है कि नहीं पढ़ा?
नहीं.
पार्किंसन नहीं पढ़ा? तो बहुत बुरा हुआ. पार्किंसन. ये Alzheimer and Parkinson are the sort of diseases which need a lot of care and nursing intervention. So NCLEX prefers such diseases. That is the thing.
पार्किंसन तो पढ़ा है, पार्किंसंस क्या है?
अरे सेम ही है, कुछ नहीं है अलग उसमें. उन्होंने बस थोड़ा लंबा बोल दिया उसको और कुछ नहीं.
I'm only Alzheimer. We have already studied Parkinson's.
Okay, so tomorrow we'll do Alzheimer and we'll do basic anatomy, functioning of heart, and we'll do hemodynamic monitoring.
Madam, can we get this question and answer through WhatsApp?
Ma'am, I'll share on the group.
Thank
yes, ma'am. We have already downloaded it.
अच्छा, जिन्होंने नहीं किया उनको शेयर कर देना.
I will share on the group.
हाँ, please share it in the group. And मैंने कल का बता दिया. Alzheimer, normal anatomy, physiology of heart, and hemodynamics. Okay. And I can't promise you that I'll use this whiteboard because पता नहीं मेरे tab में कुछ हो रखा है. It's not working properly, but I'll try my best. No, I'll try my best in the starting. Yeah, because you'll get it for further evaluation also, no? Otherwise, if you're good at making notes, then it's a good choice. But कल के लिए we'll see. अगर हो जाएगा.
No, I think making notes is good, but it is extra hard work. We just study theory and then do the MCQs. It would prepare us.
Yeah.
Exhausting है मैम. फिर questions नहीं होते अच्छे से.
Yeah, or actually understanding maybe then people will be writing only and you won't listen to me. So I prepare PPT for that. But we'll see however it is like everyone is comfortable with.
The positive point is we have recorded sessions so we can watch again.
So PPT तो I told him to provide you on the group.
Yes, but for your rationals, whatever you would just describe us.
Okay. Yeah. Okay.
Yes.
Then let's wind up.
Yes, ma'am.
Bye-bye.
Okay.
Bye, ma'am. Thank you.
Bye.
Okay, bye. Bye, everyone.
Bye.
Thank you so much.
Okay, thank you, ma'am.
Bye.